Weight was a problem my entire life. I was big and couldn't stand it. And then when my dad got sick and died, I realized I was headed the same way, so I needed to do something. My name is Andrea Griffin, and I had the gastric sleeve. I chose the bariatric surgery because my best friend had had it 3 years before me, and I liked the process she had gone through and how she looked, and decided it was probably one of the better options for me to lose weight because I tried every other diet and it didn't work. I had the gastric sleeve because the research I had done showed that it was probably one of the better options for me because of the processes and the diet restrictions and things like that. And it truly helped lose the weight I needed to lose, but not too excessively to make myself sick. At my highest weight, I was 232 pounds, and I'm only 4'11", so that's pretty big. I lost 101 pounds. I really didn't have a whole lot of medical conditions, oddly enough for my size. I was just morbidly obese, and that was going to lead to complications later in life, and I knew I needed to stop it now before it became a problem. The first couple months, it was still really hard to eat because adjusting your stomach size. So I stayed pretty much on a liquid diet from September to November, and then I started progressing into solid foods. And then it's kind of funny, I will share a 4-piece Chick-fil-A kids meal with my granddaughter, and she eats more of it than I do because my stomach is small, I can't eat that much. I first met Dr. Aryaie because I had gone back to the clinic, because that was the clinic that did my gallbladder surgery, and so I'd gone back there because that's where they had all my records to do a hernia surgery, and they told me point blank, unless I lost the weight, there was no point. So I got in with Dr. Aryaie there and scheduled the surgery, did all the tests, and had it ready to go. Dr. Aryaie and his staff are incredible people. They welcome you in just like you're one of them. They don't judge you for what you look like or what your weight is. They encourage you every step of the way to get through it. It was truly one of the best experiences with doctors. When you get to the hospital, you're thinking, oh my gosh, what am I really doing? Am I sure I want to do this? So you kind of psych yourself out of it a little bit, but then you realize you have committed this far. You carry through with it. And so after the surgery, I'm sitting there in the waiting room or the recovery room thinking, okay, I did this. This is my life now. And then getting into my normal room and realizing it's over. The surgery part's over. Now the rest of your life starts. It was great. The surgery affected my life in every area. I went through a divorce. I'm now single and having fun, enjoying life every day. I go out dancing when I couldn't do that before. So that's a major perk to me. I'm also a volunteer firefighter, and that is a huge impact, losing the weight, because you carry around the gear, and if you're too heavy, you can't function. And you need that to go. Walking upstairs, going to the gym, just everyday life has been a really good blessing for me because I've got grandchildren now. I know I'm going to be around for them, and that makes a big difference. One thing I couldn't do, definitely before, was my mom lives in Colorado, and we couldn't go on big hikes because I'd get too winded. And I'd have to sit down because your legs hurt, your feet hurt, your back hurts, everything hurts. And then after the surgery and all the weight is gone off the joints, it's totally different. You can go hours walking, or I can go spend hours at the park with my grandkids, even with my kids, just having fun. It's very different, but a blessing. Would I do the surgery again? In a heartbeat. I think this is one of the best decisions I've ever made for myself. He follows up with you. He checks on you when you've got your yearly checkups. He's there asking if you've had any problems throughout the year. And then even during the time frame in between, he's like, if you have a problem, let me know. I'll get you back in. And thankfully, I didn't have any complications or any problems because he did such a good job. I would definitely recommend Dr. Aryaie and his entire staff. He's a very good doctor, and he has very good bedside manner.